Hello and welcome back to another episode of the HT Physio Quick Tips series. My name is Will Harlow and I'm the Over-Fifties specialist here at HT Physio in Farnham. And for today's video, I'm going to be talking about how it's possible to have pain in your lower back without any specific injury. Now, I would call this type of back pain mechanical back pain. And this type of back pain is the most common type that I see at our practice here at HT Physio. I would say that 75 to 80% of all back pain is down to what we would call mechanical causes. And this can be quite a confusing topic because you might be thinking, how is it possible to have pain in your back but without any obvious injury? Because obviously we usually assume that, if I've hurt something in my back or if I've got pain in my knee or something like that, that I've sprained something or pulled a muscle or twisted it, or it's just generally had a tweak somewhere and that's causing the pain. But that's actually not always the case. Now, we used to think many years ago that everyone who had pain was suffering from a physical injury. Now we know, because of x-rays, MRIs, and even certain forms of surgery, that it's very possible to have pain in an area without any physical damage happening. So the question here is, why are people getting pain even when the structures in their back and even when the tissues are healthy and not damaged? Well, the answer is often due to mechanical causes. And what I mean by mechanical is to do with the way that you move, okay? So as you can see here, I've got my spinal model. And this is a really good representation of what your spine looks like on the inside. Now, the first thing you can note from looking at a spine like this is it's really complex, okay? There's lots of bones. You've got all your vertebrae, you've got your discs, you've got your pelvis, you've got your sacrum, which is the tail end of the bone here. You've got the nerves, you've got the spinal cord, you've got all the joints, and there's 25 vertebrae, so you've got a joint above and below every single one. So it's very, very complex, which means that when we move our spines, there's a lot going on. Now, in order to move, certain muscles in our backs and in our pelvis have to do a very specific job to allow us to do any kind of movement, okay? So they're all designed for their own specific role, and they all have a role to play in each movement we do. Now, mechanical pain can often come about because certain muscles around the back and the pelvis decide that they're not going to do their job properly. Okay, so they're either pulling too hard, or they're not pulling hard enough, or they've switched off entirely. Now, we can still move, and the reason we can still move when this is happening is because other muscles in the region try to take over, so they compensate. Okay, so if this is going on, we call this a muscle imbalance, you're not going to be aware it's going on because other areas of your spine and your pelvis are going to start compensating for the bit that's not working properly, okay? And most people can get away with this for months or maybe even years, but eventually over time, tension can build up in either the muscle that's not working properly or the muscle that's having to compensate for the other one. And this build-up of tension over time can cause pain. Okay, so that is how I would classify mechanical back pain. It's usually caused by a muscle imbalance. So usually some muscles are working too hard, some muscles aren't working hard enough. And the way we fix that is by trying to fix those muscle imbalances. Now, it's really hard to identify these imbalances on your own. Usually it takes some professional experience and someone having you down here for an assessment to have a good look at it and work out what's working well and what's not. But usually with some careful movements and some certain muscle tests, we can work out what's working well and what's going wrong to cause back pain. Now, the good news is, even though back pain is incredibly common, if it's caused by these mechanical causes, we can usually fix it. Now, it's not a fast process. It takes time because these problems have often been in place for years. But over time, you can pick away at these imbalances, you can rebalance the muscles, you can get them to do the job they're designed to do, and symptoms usually improve. Now, I hope that's made sense and answered the question of how we can have back pain but without physical damage. This is a good video to show to anyone who's had a scan or an X-ray or an MRI and it's shown nothing really to be the cause, but they still have pain. Hopefully this video will explain how that can happen. The most important thing to take from this video is that these problems can usually be helped, providing you know what you're doing. Now, if you would like some more information on how to remedy problems like this at home, then you can pick up a copy of my book. It's called Thriving Beyond 50, and it will give you 78 natural strategies for restoring your mobility and remaining healthy in your 50s and beyond. Other than that, there's some information below this video you can take that's exclusive for back problems. Feel free to download that, that's completely free. And get in touch if you'd like to ask about an appointment or to get some personalised advice. The other thing I'd be really grateful if you could do is if you could subscribe to the channel and like this video. It really helps me to reach more people. And if you're watching this on Facebook, please do share the video with your friends too. Anyway, thank you so much for joining me. It's been a pleasure speaking to you today, and I look forward to speaking to you on the next video.